Hey, my good friend Joe Moscato, who we get to have on as often as he'll allow us because he's so dang busy, is the CEO of a company called Generex Biotechnology. Obviously, vaccines have been in the news because of the coronavirus. And you're hearing everyday stories of efficacy. You're hearing everyday stories of having to store this stuff in sub-zero temperatures or whatever they're having to store it in. You're hearing stories about booster shots and are they effective and herd immunity. Well, I got news for you, and I have to tell you, I'm not an investor in this company, but it's worth looking at. They are publicly traded under the stock symbol GNBT, Generex Biotechnology, and talk about bringing a company back from the dead about 3.5 years ago. It's exactly what Joe did. But the other piece of this thing is the world of vaccines. I'm gonna have him give us an overview, then talk about the Generex vaccine. Joe, how are you? It's good to see you, man.
Thanks for having me back. It's great to be back.
So here's my question for you. Overall, give a grade to the country on vaccines efficacy right now, because there's an awful lot of questions, especially when we hear about, was it the J&J vaccine?
They kind of held up for a while.
Talk about that a little bit, then let's talk about
clots,
Generex
stuff like that, yep.
Yeah, I mean, the off-target side effects that are occurring after vaccination are considerable. We don't have data. Data has not been released fully yet on any of these vaccines, as far as safety or even efficacy or long-term memory. So those are the unknowns. Obviously, a couple of the pharmaceutical companies have already stated they're going to go to a 3-shot booster now, as well as you'll probably need vaccine yearly.
Yeah.
So obviously, there's no long-term memory associated with these vaccines, CD4, CD8 T cell activation on the back end. But that's a problem. There's 1,800 antibodies that are derived from full spike protein, and the big problem there is 1,791 of them are non-neutralizing. Those are bad guys. So those are not good. There are only 9 neutralizing antibodies in total that the spike protein gives. So, those are free radicals that stay in the body, and what's going to happen later on, 6 months to a year from now?
Joe, here's my question. I mean, just like the ever-ready battery question, ever-ready battery could make a battery that would last a lifetime.
Right.
But why would they?
Tires.
Planned obsolescence.
Yeah.
Why would you not, as a big pharma company, say, oh, sure, you need another one in 8 months? Now, is there enough FDA controls to control that kind of garbage? Or do you think that's going on here a little bit as well?
No, I think it's just the pathway. I mean, it's a 30-year-old pathway, mRNA, RNA. It's not longer with RNA. They've never worked in anything prior, but it's worked in COVID to the effect of that it does give IgG antibodies. It neutralizes the virus for a certain amount of time. It's unknown just how long. They're saying 9 months to a year. But again, it's a pathway that's unproven. They're all under emergency use authorization. And those vaccines under that moniker means it's just a very large clinical trial. So that's where we are. We're in a very large clinical trial, all these vaccines under emergency use authorization. And we'll see where it flushes out.
I remember the testing used to take 14 days.
For what?
To get tested for COVID.
Oh, yeah, that's right. It takes 14 minutes.
My girlfriend had it, and they said, we'll come back in a couple of days. And she just went straight down.
Yeah, she went to the hospital.
Her in 3 days before the test.
Yeah. Hey, Joe, talk about Generex, because there's significant differences in the vaccine you guys are developing. And I want to talk about the differences first. And then secondly, let's talk about when you're coming to market with this thing, or when do we get full approval on it?
Yeah, so we've spent a lot of time. We have a proven technology, which is our II key. Where everybody else is in gene therapy, we all deliver the same thing, peptides. So where we deliver our peptides through our proprietary technology, which is II-key, with simple amino acids and peptides. So we've always been safe, very, very safe. We're showing IgG antibody just like everybody else on the front end, but our CD4, CD8 T cell activation on the back end in our ex vivo human trials that we've done is quite substantial. So we know we're going to give long-term memory. We know we're going to give antibody production on the front end, and we know we're the safest out there. So, we're excited to get our IND in to the FDA. We responded to all of their questions that they had in our pre-IND. Our CMC on the manufacturing side is almost complete, and by the end of the month, we're going to have all 3 big lots released in chain of custody to PPD, who is our big CRO worldwide, and we'll start our trials just as soon as we get our package in with all of the CMC required information. And we're hoping that we'll have a blockbuster. We'll do a quick phase 1, phase 2, and phase 3. We're not required to do 40, 50, 60,000 patients like everyone else because of our huge track record over the last 25 years. So, we're looking forward to getting into the clinic, and it should be quick once we're in the clinic, because the beautiful thing about us is we have data already. We have data on safety. We have data on the upfront IgG antibody, and we have already data on the CD4, CD8 T cell activation on the back end, which nobody's got.
Right.
So that's what makes us unique, as well as we have a lyophilized product, which means it comes in a vial powdered. You reconstitute it with sodium water, and we've already tested all of that, and all the results on that is fantastic. So as far as us being able to deliver, and from a logistics standpoint, I don't think anybody's got it better than we do.
Well, and what's interesting about it is, and of course, we have a little bit of a biased opinion here, because obviously you guys are advocates for your own product, but really this could change the face of how the vaccines are going, right? I mean, I don't think I'm overstating that. Am I, Joe?
No, not at all. I think the key here is, how much we can make in a very short amount of time, which is billions of doses. We're quick to market, and we can get it anywhere around the world as quick as any other lyophilized product. Right. And it's all about now making sure all those ex vivo human trials that we've done in the clinic now, we get the same results. And if we get the same results, we have a big winner here.
Yeah, and I think that's a big piece of this thing, is because could you imagine if somebody changes the entire paradigm of the vaccines? Right. And look at it, if that's the way it goes, we have to get a flu shot every year, we have to get a COVID shot every year, right? That plays into your business model a little bit, right or wrong. And
the powdered form's got to be handy, because you don't need to keep it cold. You can probably ship it to someone's house. The cold version I ordered.
Is that a big enough? Because I think that sounds huge. To Russ's point, is that a big enough delineation point? Not having to refrigerate this stuff, that gets it to third world countries and battlefields, right?
Yeah. Well, let's put it this way: if I'm delivering 1 million vaccines, I gotta ship some of the vaccines that are out there right now under emergency use. We have to ship them at minus 80, minus 100 degrees centigrade, minus 4 degrees centigrade.
Yeah,
that's a tall order for third world countries and other logistical nightmares that these vaccines right now have been doing.
Well, Joe Moscato for president.
I ordered my vaccine, and it was kept refrigerated. It came with 4 Omaha steaks.
Oh, very good. Thank you, Russ.
Thank you. I had to get the joke in somewhere. Anyway. But the powdered form's pretty cool. Good idea. Reconstitute.
Joe Moscato, we'll get him into San Diego as soon as we can. All right.